Welcome to the Tennessee Heart Health Network webinar. Our aim is to be your resource for innovative statewide initiatives to improve primary care for all Tennesseans. We hope that you enjoy today's educational program and share it with your colleagues to make a better impact of heart health in Tennessee.
Welcome, everyone, to our Learning Collaborative today. We're at the top of the hour, so we will get started, but we probably will have other colleagues joining us as we continue to get going. I am thrilled to introduce our colleague, Dr. Ezra Ozdeneral. So she has a BS in agricultural engineering, an MLA in landscape architecture, and her PhD is in geography, GIS, and remote sensing. She has 20 years of experience in higher ed, and she specializes in geographic information systems. This is a really growing and hot field, especially for us in the healthcare landscape, and we're trying to make sure that the interventions that we make touch the people that need them the most and make the biggest impact. So she's highly published. She has multiple books, many papers, and she has special interests in social determinants of health, infectious disease. She worked a lot with COVID-19, Lyme disease, West Nile virus, birth health outcomes, women's health equity, opioid epidemic, many things. So I could definitely keep going, but she currently serves as a professor of earth sciences and director of the GIS certificate program at the University of Memphis. So we are all working in the same area here of Tennessee. And so I am thrilled to introduce Dr. Ezra. She says she goes by Dr. Oz as well on campus. So she's going to share with us what she's been working on, which is really a huge heartbeat of our program and is open to you all to use as well. So with that, Dr. Ezra, will you take it away?
Thank you so much. Thank you for the introduction. And today I am presenting one of the fastest growing technologies globally, Geographic Information Systems, and its application to cardiovascular health. So I'm going to go ahead and share the PowerPoint presentation. I began working with GIS in the 90s when the internet was emerging. And we were focused on creating data to meet the high demand. So we were data hungry. As technology evolved from desktop GIS, where we do the kitchen work of GIS, cooking GIS, to web GIS, and later integrated with mobile and cloud hosting, our GIS capabilities expanded significantly. Today, we can pull data from multiple sources, scale it, and create collaborative workspaces where users can contribute and share data through dynamic apps that support real-time data analysis rather than relying on static maps. The transformation of maps into apps has made GIS a more accessible, interactive, and dynamic tool for addressing real-world challenges. I use this slogan in my courses now. I say to my students, it's not just about maps anymore, it's about apps. And we are empowering non-GIS users. So that's the era we are in. Since my audience consists mostly of health professionals, some may be new to GIS. So I would like to start by explaining GIS in simple terms. It's essentially a computerized mapping system. To use GIS effectively, we need data, hardware, software, and skilled individuals. The process generally follows several key phases. It begins with data collection. So it begins with spreadsheet of addresses or spreadsheet of GPS coordinates. Progresses to data visualization and mapping. We get that spreadsheet. If we have addresses, we geocode them, then we aggregate them. If we want to map it at political boundaries or census layers, then we move to spatial analysis and modeling, followed by planning and design, and finally leads to decision-making, action, and evaluation. I included the phases of planning and design because GIS is widely used in implementation fields like engineering, urban planning, architecture. I'm an engineer myself. So these professions rely on GIS not just for mapping and analysis, but also for designing and planning projects, helping to guide decision-making and practical application in their work. Now, in the health realm, GIS plays a crucial role by providing a holistic, I'm emphasizing on this, a holistic understanding of health conditions and crisis. With GIS, we can analyze demographics, infrastructure, built environment, and social determinants of health, offering a comprehensive view of how these factors intersect to impact public health. This helps identify at-risk populations, track the spread of diseases, and inform interventions to improve health outcomes. GIS enables the integration of vast amounts of data into user-friendly, real-time applications and dashboards, improving decision-making and emergency response times in critical situations. We are witnessing a paradigm shift now from a traditional medical approach to hotspotting, which targets population health clusters. Groups of individuals sharing similar health characteristics or risk factors. In this case, cardiovascular health indicators such as high blood pressure and high cholesterol. So GIS is essential for mapping these clusters based on their demographics, disease prevalence, social determinants of health, and healthcare access. This enables public health officials to better target interventions and resources, identify health disparities, prioritize initiatives, and make data-driven decisions in disease prevention, treatment, and health policy. To determine our priority geographic areas of interest for cardiovascular health in Tennessee, we focus on those high-risk tracts that had a high blood pressure estimate over 53% and 33% and higher for high cholesterol. So the priority tracts were defined as those at highest risk for two of these indicators. Overall, there were 4 priority counties, west to east, Shelby, Madison, Hamilton, and Knox statewide that met this criteria. There were 36 priority tracts in these 4 counties. And some counties had 2 or more priority census tracts. Knox had 1, Madison had 2, Hamilton had 3, and Shelby had 30 census tracts. Now, I would like to take a closer look at these maps, which highlight the priority tracts in Shelby County and the primary care providers and health centers participating in the Tennessee Heart Health Network. Madison County is Jackson Health Center, Hamilton County, Chattanooga Area Health Centers, and Knox County, and participating health centers in Knoxville. The next step of the census tract analysis was to consider the population in priority tracts and to determine any clusters of tracts. The 36 priority census tracts across 4 counties had a total population of 64,434 over age 18 adult population. The population of priority tracts in each county ranged from, as you see in this chart below, 39, like 3,920 to 547 people. And if you look at this in Shelby County, highest amount of people and the lowest amount of people in a tract were all in Shelby County. And this is also showing the distribution of Shelby County in comparison with the overall 36 priority tracts and the 30 tracts in Shelby County in highlighted blue. What we see here, 51,973, almost 52,000 people in those priority tracts in Shelby County. And if you look at the histogram next to the map, it shows, and in comparison to the map, higher adult population in the southern census tracts. And we see 5,000 to 10,000 people almost in those areas, in the darker areas. In Madison County, 3,000. The clusters are 2 census tracts. Hamilton County, 6,904 and almost 7,000 people. And Knox County, 2,468. So Shelby County has more amount of people, of course, comparison to these counties. And Shelby and Knox are considered urban, and the other 2 are rural counties. All those 36 targeted census tracts qualify as low-income communities with higher rates of poverty, food insecurity, vacant homes, poor transportation, higher share of minority populations when we compare with county, state, and national level values. So I would like to see the social determinants of health related to these areas. But first, I want to typically categorize how the social determinants of health are categorized into 5 key areas. Those are economic stability, shows income, employment, and financial resources of the community, educational attainment and opportunities, healthcare availability and quality of health services, neighborhood and built environment, housing burden, especially housing burden, transportation, access to healthy foods, and social and community context, like is there any social support or community engagement or discrimination? So if you see these circles, these housing burden, poverty rate of 15% and higher, no high school diploma, this is mostly CDC uses these variables for their interactive maps. Apparently, there's so many of them as social determinants of health indicators, but they usually use these variables. So I'm going to show some of these variables at my presentation as static maps, and then I'm going to move on to the mapping portal. So percentage of persons below 150% or higher below poverty in Shelby County. As you see again here, 82% people in these census tracts, in these darker census tracts, are below poverty. And I want to give and pay attention to the Hamilton County, like the squares on the top and down below. This one is Hamilton County. Maybe I can use a highlighter. Yeah, let me use a highlighter. Yeah, this is Hamilton County, has a high poverty population. I mean, they're all high. I mean, 40%, 41%, and 9%. I mean, they're all high, but the highest amount is 82%. Almost all of the population is in poverty. Unemployment rate, 44% and 9%, like almost 45% of these Shelby County tracts have unemployment rate. The the average unemployment rate among all those 36 priority tracks is 19.8, like 20% unemployment. And again, in this tract by Hamilton is 23, almost 32%, between 23 and 32% high unemployment rate. Minority rate. Minority rate includes African American and other minority populations. Here, almost all of these tracks, 84%, almost 85% and above are minority population. And in Shelby County, 96%. These darker areas are higher, 96%, 98%, and some of them are 100%. So we see 84 and above in other counties, in other tracks in other counties. I like to show the Shelby County priority tracks versus the percent Black. It's just 86 and above are all African American, and it's just so similar. Just the pattern is almost identical. And the percentage of housing cost burden. Here, Knox and Hamilton actually show up like they are having housing burden issues, where based on their income, the housing cost is 2/3 of their income. So they're under the housing burden in these areas, Knox and Hamilton. Shelby County as well. But some counties, some tracts that were not showing as much, now this northern tract here is, and some northern tracts in the middle are having housing issues. 69, almost 70% has housing burden. Uninsured population. I mean, Hamilton County is definitely, Madison County also, they clearly shows that they have, this is no high school, I'm sorry, this is no high school diploma. So it's showing that 43% and higher have no high school diploma, or 51% or higher average, no high school diploma in those areas. So these rural counties have education issues. This is uninsured population. And in terms of uninsured population, we see Madison census tracts are clearly showing that they have uninsured population insurance coverage issues. And Shelby County, some tracts clearly show that they are above 40%. The average is 17% that are not insured in these tracts. All right, now I would like to transition from static maps to demonstrate how GIS functions as a modern tool for contemporary healthcare approaches. So I'll showcase the Tennessee Heart Health Network's ArcGIS experience site, emphasizing its capabilities in visualizing health data and facilitating data-driven decision-making. And additionally, I'll provide user experiences to illustrate how this interactive platform allows users to explore various health-related data, gain valuable insights, and enhance public health initiatives. So just brief overview, I will show the layers, showcase how different data layers can be overlaid on the map to provide context. And then zoom in and out capabilities, demonstrate the ability to zoom in for detailed views of specific areas or zoom out for broader regional perspectives. And then highlight how GIS can generate charts from the data, allowing users to visualize trends and comparisons. And then drive time zones, illustrating how to create drive time zones that show the areas accessible within a certain time frame, useful for analyzing service and accessibility. Then I will present infographics summarizing key data insights related to the drive time zones, such as census population demographics and health resources, enhancing understanding through the visual storytelling with infographics, and then the healthcare and insurance data and resources, enhancing understanding through the visual infographics. So I'm gonna stop the share, and then I am gonna go to the portal site. You go to Tennessee Heart Health Network .org website, and then under resources, choose the maps portal. And once you choose that, you will be able to see the mapping portal site. And it comes with a disclaimer and instruction information and disclaimer information. So you can read that, and then you can exit out and continue with the portal site. So the way I configured this is you have a map in the interface below, and you have layers that you can on and off, make it visible or invisible. So it came with center, community-based organizations, community health centers, and community schools already visible. And I'm gonna add our base layer, 36 census tracts into this. And now I have all of them showing. I'm gonna go ahead and zoom in, zoom out capabilities. And as you zoom out, the labels are becoming much more available because they go with the scale. So it shows the centers. You can click on any of the center, and it will give you Methodist Minor Medical Center, for example, its location. You can toggle it, exit out. It from the Methodist mentor, like I'm gonna just, well, yeah, I'm gonna just show with the go with the tracks first. So it kind of shows you. You can zoom in, zoom out. It shows the layers. You can turn on and off the layers. You can click on the layer, and it will show you the information of that layer, and exit out. Next, I'm gonna click to tract. So what happens is when you click on the top layer information shows up with the configured social determinants of health table on the side. So you see the table, in the table you see in that very tract, I'm going to toggle this so you can see the tract here, the social determinants of health data, housing cost burden, single parent households in that very tract. And then if you scroll down, you'll be able to see a chart showing these social determinants of health with its values. Like in that very tract, 63% poverty, 36% no broadband subscription, no diploma age, 18%. And then, of course, we see this minority status as an African-American population, almost 100%. And then we have the housing burden, 47%. So it kind of gives us a clue of the high blood pressure prevalence in this area. 54 is clearly a priority track because 54.9 is over 53%. And the comparison with the social determinants of health here. And each time you can go to each census tract and then see in each census tract what's going on. So the one that's slightly above has now, again, like you can see 98%, you see unemployment rate is higher here, and housing cost burden is high. So you can kind of go each one and see the comparisons. Next, what I'm gonna do is, it is already like any of these, like let me click on one of them, and this one shows up here on the right side. Now I'm gonna do infographics, like search. from the, just for that census tracts, I want to know more information. So I go to infographics, and in this case, with the infographics, I can choose different topics. There is census summary, eating places. There's Esri graphics, and there's gallery infographics that I edit, which has race and Hispanic origin, race. So specifically, if you want to look at race. And Esri infographics, the software company, Esri's infographics, you can actually choose some of these. I'm gonna kind of toggle through and see what we have. Community change snapshot, 20 census, emergency information, key facts, demographic profile, at-risk population, healthcare insurance statistic, commit profile. So I'm gonna go to, let's say, at-risk, no, let's just first start with just simple census, 2020 census. Let me click on that and then run the infographics. So in that very track, it shows the map of the track first. So you have on the left the map, and it gives key facts of the population, total population, population density, average household size, total households, and diversity index, and then gives total population by race. Of course, we see here immediately 96.7% is Black population here. Population by age and race, crude numbers less than 18 years, and then 18 years and older. And then you can go down to the next page. It shows like population by relationship, like how many biological child located, householders, 37.9. And then you can look at more detailed Hispanic population by age and race, non-Hispanic population by age and race, and then you can continue more with total housing units by occupancy. Like immediately when I look at it, I see vacant lots a lot, other vacant, 28.5% in this area, or rented but not occupied, 9.8%. So this is the 2020 census. You can, one more capability of this is you can export these infographics as an image or as a PDF and like have a report of that census tract. So I'm going to exit this out. So I want to show more. I'm going to exit this one out. Now I'm going to show another infographics. Let's choose at-risk population in that area and run infographics. At-risk population, households with disability, age 65 and above, 968 people live in this tract, 65 and above. And households with disability, 668. You can see that households without vehicle is 273. And and their poverty and language, households below poverty is 697. So you can see more detailed information in here. And then also language spoken. Now, I like to, this is aerial unit, like you're interested in what's going on in terms of at-risk population. Let's say for that census tracts, let's go to and find out the health expenditure. So healthcare and insurance statistics, and run. Here you see again 43% exercise at home 2 times per week, 9.1 exercise at fitness clubs, health insurance coverage. So you see, based on that infographics topic, in that very track, you're able to see the picture, like population age, and how much, we can say that 19 to 34 years old population, 8.7% has one type of health insurance in that tract. So I'm going to exit out. Now I'm going to show another functionality. In this case, I'm going to choose a location and then create a drive time around it. So maybe I can zoom in, zoom out, and then see, let me see, Christ Community Health Center. Yeah, Christ Community Health Center, maybe around here. Click on it, Christ Community. I created buffers, so you can search it. You can click on, when you do the search, you pinpoint the Christ Community Health Center, choosing it, or you can actually, instead of choosing it, you can also write the location, an address, like 2569 Douglas Avenue, or even write the name, like Christ Community Health Center. Of course, going to show, yeah, Douglas Avenue. And you choose that, and it goes to that. And then when you do a buffer, you can use 1, 2, 3, 5 miles buffer, or let's you walk time or drive time. Let's just choose a drive time and apply the drive time. So when you do drive time, of course, it shows organic boundary. And from there, let's do the same thing, healthcare and insurance statistics from Church Health Center. I mean, from Christ Community Health Center. So what you see here is in this 5-minute drive, there's 17.9%, 19 to 34 years of olds have one type of health insurance. And you see that in 5-minute drive. You can do that by 10-minute drive and see the statistics and the comparisons you can make. Another cool thing is you can click on these and find out what they really mean by these. Explore more, like it gives more information by charts, like average dollar spent per household. You can compare with Shelby County, okay, and you can compare with Tennessee or even US for that 5-minute drive or 10-minute drive area. So so in other words, you can click on these and explore more. Like here, exercise at club 2+ times per week. Now, so those dots that you're seeing here are showing the comparison to Shelby County. And then maybe we can do Tennessee, or maybe we can do United States overall. Okay. And there's a possibility you can also export that image. So in an easy way, quick way of, for that very area that you're analyzing, coming or having charts. And then 10 minutes drive, you can also do 15-minute drive. And another cool thing I like about this is doing this side-by-side comparison with 5-minute drive, 10-minute drive, and 15-minute drive. And you can actually click on these numbers, like, okay, I'm interested in this 15-minute drive, has one type of health insurance of these population, and then it gives this 0 to 18, 19 to 34, like in that population, out of that, this many, it gives the crude numbers and the percentages for that health insurance coverage and age. And you can also export that. So in other words, don't worry about it. Just go on there, explore for more, and it will give you more information rather than just numbers. And then you can scroll down and find out more, like exercise thing that was showing before. Now you can kind of read more about it, explore more. And there's the explanation. Again, comparisons. And then more. of course, this data is coming from American community. It also shows like where this data coming from. This data coming from American communities survey. Yeah. So again, you can export this as a PDF. Now I'm going to exit this out. In that infographics, I'm going to show also, let's do the drive time analysis. So let's just exit out, back, exit out of this. Let's do a drive time. For drive time, we can choose, we can zoom in and choose an area, or we can just write. In this case, let's say Christ Community Health Center. Christ Community, I can click on this find address box below down, and then go to the community center. It comes up with a toggle plus there, and click on it. It chooses this address, or you can just, because you need to kind of zoom in more to get the very address, or you can just type in the address, which is 2569, or you can, you know, like Christ Community Center here, you can, if you don't know exact, you can just go click on it and then copy paste from there to here. That way you don't have to worry about the address. Here you go. So we got the address. Here we are. It pins the address, Christ Community, exact zoomed in, and then find address or place to where it could be. You want to know the patient's address to the Christ Community. You want to show the patient the address to the Christ Community, or to somewhere else. We can say maybe Memphis Birthright. Yeah, Birthright of Memphis. It shows up, and then it creates the drive time from Christ Community Health Center to Memphis Birthright Memphis. And then you can go down below, see the directions, how many minutes it takes. It takes 52 minutes. And it shows the route. If you want to print out the route and give it to the patient, you can print it like that, or cancel the print, or yeah, or you can print the map from here, print the map. So those are some of the other capabilities you can use in the map. Find address place as well, like you can write Christ Community Health Center, or we can write the address here, and then from there create your buffers. So that's how the directions of drive times all works. Now I'm going to move on to community-based organizations. This one is, you have, I think I already had something here. This is the Church Health Center. So I'm going to exit out so I can demonstrate again. These are all the community-based organizations layer in Shelby County, or in Tennessee. And you have the database here, and we populate this database. If we have more participating ones, we will add this to these records. So you can just go from here and choose one, let's say Memphis Rocks here. And once you choose it, it chooses in the map, as you see highlighted, or you can go from the map and highlight it in the database, in the table. Like for example, this one, I'm not sure what this is, but I'm going to click on it. It shows Memphis Delta Prep Charter School. And once I click on it, yeah, Memphis Delta. Click twice. Yeah, it brings up its data here and its phone position. What I like to emphasize here, the social service category, like this is literacy and youth related. So there is categories that we edit this into the, it started with a spreadsheet, and then I put it into GIS with the addresses, and then I added the social service categories. So then, like, you can see housing description, mental health. This service is mental health related, social service category, and the category description is postpartum care. So we can kind of see food assistance. When we click on these community-based organization, we can find out what service category they are. Also, now I'm gonna choose a location. Let's say, let's do Church Health again. Type in 2569 Douglas Avenue, Memphis, Tennessee, 381114. Yes. Choose it, it goes there, it pins it. So this is what it pins. And then from there, I want to know how many community-based organizations around it. So I can choose, let's choose not kilometer, miles. Let's do miles. Here, 2 miles, there are 6 community-based organizations. So I'm going to click on those, and it flags those 6 ones. So let's say 0.8 mile, I click on that, and it's showing Freedom Healing Wholeness Incorporation. It gives us information. You can click on it. It's a mental health counseling and crisis management. And next, I can go from the map, and I can go from the mileage, like this is 0.8 mile. I can go to 1.8 mile on the right, and then click it's new ballet ensemble. 1.84 miles from Church Health Center is communities and schools, so on and so forth. So this gives the community-based organizations in that. And there is also drive time tool here as well, where you put the community-based organization's name or address. In both ways, it gives the drive time, how long does it take to get there, and the route. I am gonna move to the last. Yes.
Oh, I just wanted to interrupt and ask, does anybody that's attending today have any questions while we have Dr. Ezra here?
Yeah.
I know that yesterday I was playing around with the tool quite a bit. And for instance, I put in one of our census tracts that we work in, and then I put in my own address. That was one way. I think that playing around with it is one of the best ways to see
Yeah.
how you can. So I did, let me see what I did over here. I think I did the demographic summary. And so it was showing, like it kind of just shows you who's in your neighborhood or who's in the neighborhood maybe where you serve. And that might be, a lot of us are probably familiar if we have clinicians on the call. We didn't do introductions today, but like for instance, it was showing the high school graduation rate. And I mean,
Yeah, you can do that.
that one, and then the per capita income, the median household income, and then versus the median net worth. That was the one. And I mean, so comparatively, even when you're talking about maybe like 15 miles, you can really see the disparities there. And I think that can really help open some eyes. And then then when we have the community-based organizations, then it can kind of help us not get stuck in that loop of like, okay, so now we've identified the problem, then what do we do? This is what we already have available to us here. And there's still going to be problems, but what can we solve in our own neighborhoods and that type of thing?
Yeah, I wanted to show a bit on the health estimates layer as well. Like, you can click on the priority track, and it will show the other asthma, cancer, mental health percentages by environmental justice index. So you can also compare with the other non-priority ones. census tracts. And then I have this healthcare proximity, which is overall, you click on this tract, it gives you the distance to the nearest urgent care or the medical surgical ICU. Here, like this one is, when you look at this, there's 7.1 miles to the nearest medical surgical ICU. When I click on a suburb here, it is only a 1 mile. So you can see the disparity here between these tracts by looking at the healthcare proximity as well. So I have those layers that I've added as well. Do you want me to demonstrate more, or do you want me to stop? And if you have any questions, please go ahead. Ask any questions. I'm going to stop the share. Yes, there's a lot into it. It's just
There's a lot.
There's a lot into it. You know, I put a lot of hours into it. So
Yes.
you got to really. The thing is, there is technology out there, but how to orchestrate all of them together is a little bit thinking as well, right? So I've done some thinking at first, what would be best, and then expanded, and then of course it's trial and error. Like if I put this widget, this tool, how is that going to show which one is better? So there are ways of showing this as well. There are ways of, this is just my perspective, and it gets better as I play with these tools. But there's data available out there. Like there's tons of infographics. I just choose the ones that are related to health.
Dr. Esra, I have a question, and
Yes.
I don't know even how to ask it, but I will just give it a shot. So, you know, there are apps out there for individuals, for example, Map My Run, that I've used on a personal basis. Are you familiar with apps like that? Do they interact with the GIS portal? And I'm thinking, for example, if we had people out in the community doing work, you know, talking to, you know, about CBOs and things like that, if we could track where in the neighborhood specifically they're going to, is there a way to, like, they can populate and send it to you and populate? Is there a way to that they can talk or merge the information? Am I making sense?
Yes, Gladys. If there is a data that has a spatial component to it, we can put it into GIS. Okay, so, but how we're going to present it, how we're going to create the user experience, or do you want to present people's individual movements and stuff? That's a question, but you can create routes. Like in a person in a neighborhood, they're like tracking. I've done this before with pregnant women in the 2000s. We've done research related to pregnant women, and we track them with GPS and see. So we put it into GIS and like and then add data to each location. So you have to have data, location, and then create a layer out of it. So Gladys, what it is the work is mostly in the kitchen. The creation of the data. You create the data and then you create a map out of it, a layer out of it. Okay. And then put it on the cloud is how to create the user experience. So these are components. First, I do the desktop GIS, which is the kitchen part. Like really, before you serve the food, you really have to put in all the ingredients, right? That's what I do. But then it doesn't stay there. How am I going to present it? You want to share it, you put it on the cloud. That's why we have an ArcGIS organization. And then the organization is UT Health Science Center. On that organization site, we put the data, and then we want to see how the user will experience it. So whatever we have in desktop GIS does not work. We need to create another symbology and how to show in the cloud as well. Yes, so yes, you can, any data that has a spatial component can be put into GIS. And then you want to track them with an app. From GIS to an app is also a developer situation. So you create an app development that you need to make it available for Android and Apple. And sometimes you also need to think like the amount and time, effort, and the expenditure that you spend on that, will it be worth it? Right now we have a web application here, and there people can look at it from the desktop. But if you want to get it to an app, there are apps that the software company has, like Story Maps or Survey 123. So those are available with Tennessee Health Science Center that we can maybe do a test study with that, use a population and then put in the data and then see if the app will work. Yeah, so answer is yes. It's just how it's going to be used, whether it's going to be used and all that. Yeah.
Thank you. Then I'll figure out how we can talk later offline and
Yes.
just try to figure out how to, because I've got some ideas of some other things that we can
Yes.
do to include more data. Thank you.
We do have
There's
some comments that are saying they really enjoyed the presentation. I think
I think
I think you're right. It's a lot of information to digest, and we do have the link that Gladys put in the chat for anybody who wants to go in there and play around with it and, you know, look at your own neighborhood, look at the neighborhood where you serve, where you work. Oh, we've got a question from Joyce Brown. I'll go ahead and unmute Joyce and feel
go
free to
ahead.
ask.
Well, it's more that I've enjoyed your presentation, and I see all the wealth of information that is included on this. And my question is, with the things that I do and in the neighborhoods that I am, I see a lot of the percentages of diabetes, heart disease, and everything. I see all that included on on your presentation, which is something that I kind of wish I had, coming in as a community health worker. But what I'm asking is, with this information, say for instance, I was talking to a client or a patient and they needed to go to a certain um doctor or a place, you have all the list of all the community uh, places there. And if I see how that we could use this as a place to find organization that I could send this client to if they needed to go here, there, as a community health worker or a health coach or whatever, I see that on your map. Now, like the person mentioned before, I have to play with it a little bit because you have a whole lot going on here, and it's such a wealth of information that it could be very valuable to community health workers as well as health coaches or anybody in the community that needs to um, target in on where certain people need the help, because the social determinants of health, I see those, and I just can't stop thanking you for that, because it's showing a lot of things that our communities leaders need to know, um, so they can go and target those areas. So I thank you and I commend you for your presentation today.
Joyce, it gives me goosebumps. Let me tell you, when I came to Memphis 2003, I started doing health research. I first created spatial morbidity data, infant mortality data. I did low birth weight studies. And it just, and then an 18 years old died in 2003 from West Nile. And I said, okay, why don't I just do that research? I got the mosquito pools and I created maps, and they didn't even have at the time GIS capabilities. And I had two Polish students. We're not from here. I'm originally from Turkey. And I have two students from Poland. We did the research in GIS. And one day, we put in temperature, we put in all the mosquito pool related data, environmental data. We did not put any socio-demographic data. We did climate variability study during that time in August to see mosquito pools and where these clusters are. And we found these two tracks. The people are dying in these two tracks. I said with my students, hey, we found this. We did it on the computer. Let's get into the car and let's go to this place. With my two Polish students, we went to the place. And you know what we found out?
What?
It was Section 8 housing.
Wow.
So I'm a firm believer as a geographer, as an engineer, I'm an environment and human relationships. I gather all those together. I'm a firm believer we need to be on the ground working with people. Yes, we create
Yes.
data, we see what's going on, but we need to work with people also. So what can be done with this? We can put environmental data on this. It's just data is out there, technology out there. You give the time and energy to it, and you create these things. But again, how are you going to do that connection? And once you know what is out there, and you just go there and create that connection. And you guys are very important for this, to make those connections, to create those connections. So I'm a firm believer of this. Now we know there's tools out there we can play and create and make it better. But Shelby County, we know where the problematic areas are. And we're going to learn more and more as we do more research and see what can be done. In terms of creating connections, this is a cardiovascular health network. There are other ways of looking at location services. There's so many other services with location services, but this one is what we provide to the users. This is what you see. It's more like the social determinants of health, or the census information, and also whatever that we have that we collect, we prepare it to the users. We create that user experience. So in other words, if there's data, like if I have like primary doctor locations, I can put this here as a map, and then you can go type in the primary doctor's information, and then you can direct your patient to that primary doctor. So yeah. Yeah. Any other questions?
I just wanted, I mean, you're about to make me tear up here, but I'm so sensitive about the community and the involvement. And with what you have created and what you have presented today, only lets me know that there are really people out there working to provide a way that we can help everybody, not just one group of people, but all people that need these services. And I um just thank you, because it's all working together. It's all working together. I'm one of those people that are out there in the community. There are doctors on, and everybody that's seeing patients and everything, and it's all working together. So this is just another stepping stone on to getting to the place where we need to be. And I just thank you for this. And
Yeah.
I'm gonna drop the hat right there. But I really thank you so much. So much.
I thank you, Joyce. I think what it is when I started after my PhD, I started as an assistant professor. Um, we did all these publications and everything, and either online or they're on the shelf. But as you grow in your research, you realize I want to do tangible results. I want to get tangible results. So now over time, assistant associate full professor, like I want to get into my car and go to these communities and just I like whatever I create, I want tangible results. And I think Jim Bailey and his team are working for that. And this and CDC's mission is that too. So I appreciate you all coming to this presentation and finding out about what can be done. And I appreciate you all. Any more questions?
Yeah, we've got about 1 more minute.
Yes.
And I was going to say, I know that sometimes we are not as familiar maybe with neighborhoods we don't live in or that we don't go to, but
Yes.
it's really interesting to use a tool like this because I mean the numbers are the numbers, like I just said, when you're using something from a 15-mile radius, and somebody like I've lived in Memphis almost my whole life, and you see like in one neighborhood you've got estimated net worth over $800,000, and then you've got one that's
Mhm.
$10,000. That, I mean, you can't argue with data like that, and you see like what would happen if there was a medical emergency in this family? What would happen if you were in a car wreck, et cetera? And I think it's a huge learning tool for all of us to use and for us to create solutions. So I thank you for creating that, and it takes our work farther. And I appreciate everyone for being here today. So this presentation will be posted online on tnhearthealth.org, and I see some more comments here that really appreciated it. Nikki will also be making sure that there will be a link from that presentation so that you can go to the interactive map and play with it. So to me, that's the best way to learn from it and to put in what's important to you in our state. But you can put in all kinds of addresses in there. So it's continually being updated, and we thank you all for attending today. And please let us know if you have any other questions. Thanks so much.
Yes, and adaptability is not that easy, but you have to really, it's kind of like when you did cell phone, you play with your cell phone, you become more familiar. It's kind of like that. I try to make the user experience as easy as possible, but I'm also limited with what the resources are, but with that, we still we still, were able to get something out there.
Yes. Thank you. Thank you. All right. Thanks, everyone. We'll see you next time.
We hope that you've enjoyed today's webinar. For more information and resources, please visit our website, tnhearthealth.org. You can find more webinars under our resources page. You can also follow us on Twitter, LinkedIn, and YouTube. Please let us know if there are any specific topics or speakers that you would like us to present. Lastly, tell anyone you know who would be interested in helping to decrease the burden of cardiovascular diseases in Tennessee and share the webinar. Together we can achieve our goals of managing and preventing heart attacks and strokes for Tennesseans.